Hello.
Hi.
How are you?
Good, how are you?
Good. My name's Karen. I'll be your nurse today.
Okay.
Can you tell me your name and date of birth?
Gnarly Reynoso, 4788.
All right, very good. Do you know where you are right now?
At the doctor's office.
Great. And who's the president?
Trump.
Not for long. And what year is it?
2020.
All right, very good. I'm going to ask you a few background questions.
Okay.
Before we get started on the assessment. How old are you?
I'm 32.
Very good. What's your marital status?
Married.
And what's the date of your last physical?
Last year, around this date.
Very good. Any childhood illnesses?
No.
Perfect. Are you up to date on your immunizations?
Yes.
Oh, that's what I like to hear. Any diagnosed medical conditions?
No.
Very good. Any previous surgeries or hospitalizations?
No.
Very good. Any blood transfusions?
No.
Okay. Any medications, including over-the-counter drugs or herbal supplements?
No.
Perfect. Any street drugs?
No.
Very good. And any allergies I should be aware of?
No.
Perfect. All right. Okay, a couple more questions. Do you exercise regularly?
Yes.
Okay. About how often a week?
3 times a week.
Perfect. How is your dietary intake?
Good.
You have a good appetite?
Yes.
Okay. And how about your caffeine intake?
Normal.
What's normal?
1 cup a day.
Perfect. Do you use tobacco?
No.
How about e-tobacco?
No.
Are you sexually active?
Yes.
Are you trying for a pregnancy?
No.
Any discomfort with intercourse?
No.
What contraception do you use?
Tubal ligation.
There you go. All right. Do you live alone?
No.
Okay. Do you have frequent falls?
No.
Vision or hearing loss?
No.
Do you have an advance directive?
No.
Living will?
No.
Would you like information on preparing these?
Sure, maybe at the end.
All right. Perfect. Physical and or mental abuse have become major public health issues. Would you like to discuss this with your provider?
I'm okay.
All right. Very good. How about family health history? Any significant health history from your mother or your father's side?
Just diabetes on mother.
Okay. Very good. Let's talk a little bit about your mental health.
Okay.
Is stress a major problem for you?
No.
Do you feel depressed?
No.
Do you panic when stressed?
No.
Do you have problems with eating or your appetite?
No.
Do you cry a lot?
No.
Have you ever attempted suicide or thought about hurting yourself?
No.
Do you have trouble sleeping?
No.
Have you been to a counselor?
No.
All right, very good. A few more, we're almost done.
That's fine.
Age at onset of menstruation?
I think I was 12.
12, okay. And then date of your last period?
1 month.
It's November.
No. Last week, or November.
Last week, all right, perfect. Any problems with your period?
No.
Okay, how many pregnancies and how many live births?
2 and 2.
Perfect. Any blood in your urine?
No.
All right, very good. Any hot flashes or sweating at night?
No.
Okay. Last pap smear.
Last pap smears 2 years ago.
Okay, very good. Okay, very good. That's that. Now we're going to do a quick head-to-toe assessment.
Okay.
Patient appears stated age. Patient is alert and oriented ×4. Skin color is appropriate for ethnicity. Patient appears well-fed, well-groomed. Posture is erect. Patient has no physical deformities, no limits in mobility. Facial expression and speech patterns are appropriate for environment. How much do you weigh?
150.
And how tall are you?
5'1".
Okay, very good. I'm just going to take your vitals real quick. Okay. All right. Patient's respirations are 16. All right. Pumpy, pumpy, pumpy. Pumpy, pumpy. Perfect. 120/80. All right. I'm going to assess your head now. I'm going to palpate your scalp, your hair, your skull, and your face. Can you open your jaw a couple times? Good. Patient's head and face is symmetrical. Cranial nerve 7 is intact. Sinuses are non-tender and not swollen. I'm going to check out your eyes now. Very good. Can you follow my finger? Very good. Patient's pupils are equal round, reactive to light and accommodation. Cranial nerves 3, 4, and 6 are intact and within normal limits. Peripheral vision and central vision are intact. Can you look at the wall over there on the Snellen chart and read the bottom line for me?
EZDVX.
Perfect. Patient is able to read bottom line with no issues and no corrective lenses. All right, we're going to assess your ears now. You got some potatoes in there.
Karen.
Carrots in that one. All right, very good. I'm going to do something called a whisper test. Okay. Were you able to hear me?
Yes.
All right, perfect. Patient's hearing is intact, no masses, no perforations, no tenderness, palpation. Does that hurt?
No.
Okay. Whispered words heard bilaterally. I'm going to check out your nose now. Beautiful. Very good. Patient's nose has no deformities or tenderness to palpation. Does that hurt?
Mm.
Good. Septum is midline, mucosal lining is pink, and there is no drainage. All right, we're going to check out your mouth. Can you open your mouth for me? Stick out your tongue and say, ah.
That's dirty.
Very good. I'm going to pretend to stick my finger down your throat. Are you going to gag?
Mm-hmm.
Good job. Patient's mouth is pink. No lesions or bleeding. Tongue is symmetrical. Pharynx is pink. No exudate. Uvula rises midline upon phonation. And gag reflex is present. All right. Now we're going to look at your neck here. Turn your head left and right. Good. And now push against my hand. Good. Push against my hand. Good. And shoulder shrug. And against resistance. Good. Where are we? Patient's neck is supple with full range of motion. Symmetric. No masses. Tenderness. Swelling. Trachea is midline. Thyroid is non-palpable. Non-tender. Jugular vein is flat. Carotid pulses bilaterally. And let me check for a bruise. No brewing. All right, now we're going to listen to your lungs and heart. Well, it's, the lungs is the top. And then we get to here and here. And then heart's here and here. And here. And here.
Mm-hmm.
Good. And back. Take a deep breath for me. And again. And again. And again.
Oh my God,
Don't faint. And again. Uno más. Very good. Do you have any tenderness here?
No.
Any tenderness here?
No.
Very good. Patient has symmetric chest expansion. Oh, I forgot.
You want to cut it?
Nope. Can you say 99?
99.
99?
99.
99?
99.
Very good. Patient has symmetric chest expansion. Tactile fremitus equal bilaterally. Breath sounds clear to auscultation bilaterally. No tenderness over spine. No costovertebral angle tenderness. Patient has S1 and S2. No S3 or S4 heart sound. No murmur. And the PMI is the left mid-clavicular fifth intercostal space. And the patient's apical pulse is 78. Sorry, excuse me. All right. Now I'm going to assess your upper extremities. Can you grab my fingers? Squeeze. Good. And then pull against my hand. Push against my hand. Do the same on the other side. Push. And turn your hand. Pull. Pull. And let me assess your pulses, your brachial, and your radial. Great. And cap refill. And decide. Good. Patient's brachial and radial pulses are 2+ and equal bilaterally. Skin is intact, warm and dry with no edema. Cap refill is less than 2 seconds. Full range of motion bilaterally in upper extremities. All right. Can you lay down for me so I can look at your belly? Patient's abdomen is flat, symmetrical. Skin is dry and smooth with no lesions, scars, or striae. I'm going to push down, let me know if there's any tenderness.
No. 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 No.
Abdomen is soft, no masses or tenderness upon palpation. Bowel sounds and tympany present in all 4 quadrants. You can stay seated if you're laying down.
Seated or laying down?
That's what I mean. You can stay laying down. Because we're going to assess your lower extremities now.
Okay.
I'm going to check some of your pulses here. Good. And tops of your feet, popliteal, and then your ankle. All right. Can you raise each leg independently? Good. Wiggle your toes. Shake your ankles. Great. Patient has full range of motion on lower extremities bilaterally. No edema and equal bilateral pulses. Okay, you can sit up. Where's our objects? Can you close your eyes? I'm going to hand you 2 objects. Tell me what they are.
Spoon and a pen.
Great job. I'll take those back. Keep your eyes closed. Give me your palm. I'm going to draw a figure. Tell me what it is.
Circle.
Very good. Okay. Can you stand up?
With my eyes closed.
Well, open them to stand up. Now close your eyes. I think you're actually supposed to push the person for the balance test. All right. And open your eyes. Bend over so I can assess your back. Very good. Now walk 3 steps that way. Turn around and come back to me. Very good. Patient is able to identify both object and figure in hand. Balance is within normal limits. Gait is steady and scoliosis is not present.